UK, and we are here to discuss insights and learnings from COVID-19 pandemic. I'm honored to introduce Professor Minesh Khashu because he has several national and international awards of repute, not only from the UK government, but he's widely acknowledged across many countries in the world. He has empowered the care during COVID-19 on the front line, but he has some very amazing innovations in system level workflows, in clinical workflows. Most people don't understand the complexity of healthcare system when you run a hospital or when you run a county level or a nation level healthcare initiative. But Minesh has delved into a lot of depth, not only in neonatology but also system level clinical workflows. He's an innovator of his own right. And what was interesting to me was he wrote an open letter to the Prime Minister of UK about what can improve in the nation during COVID-19 pandemic. And to me, he's a very fond mentor, and he has given me visibility of healthcare systems in US, UK, and many more countries in the world, including India. So Minesh, welcome, and I'm truly honored to have you here.
Yeah, thank you, Vida. Thank you for those gracious and kind words. It's a pleasure to speak to you and to other colleagues who have joined us today about an important subject, a subject of what we can and should have learned from COVID-19. As you know, the last 18 months have been quite surreal, quite almost a horror movie or a nightmarish sort of tale that has been running on planet Earth. And one of the important things we need to do now, as we're trying to sort of put together the pieces back, still perhaps some way to go, but we are hoping that we are beyond the worst, at least for this sort of pandemic. And as we try to wrap up the difficulties, the damage that has happened in the last 18 months, I think it is quite important that we focus on what have we learned, and we focus on how we're going to be different going forward. And if something like this were to happen again, how would we be better equipped to manage it? And when I say manage it, it is better equipped to manage it at an individual level, at a societal level, at a global level. Because all said and done, we haven't really, apart from a few exceptions, really managed this pandemic that well. A lot of times we use the word unprecedented, and it is true that it was an unprecedented calamity that came to us, but our foolishness, our lack of preparation, our lack of collaboration was unprecedented as well. So while the attack might have been unprecedented, our inaptitude as a global community in a lot of ways was unprecedented as well. And there have been some great things that have happened during the last 18 months, and I'm sure we're going to talk about them. So I'm not going to wanting to paint a totally a negative picture, but there's a lot that we need to say to ourselves and to each other. There's a lot we need to do in terms of thinking, so that going forward we show a better way for each other, for humanity at large.
Awesome. So Minesh, I had a question about, we are in a phase where we are getting vaccines deployed. So vaccine deployment. What are your thoughts on the vaccine? It's on everyone's mind. So let's move on from this phase backwards. We are here. We are getting vaccines deployed to different tiers. What is it like now, and what should have been done to make this particular phase better?
No, I think vaccines in a lot of ways can be considered one of the success stories of the pandemic. And the reason I'm saying it can be considered is that the vaccine process is going on in most countries. We haven't yet seen the efficacy of those vaccines. We need to make sure that the safety, the effectiveness, the efficacy of those vaccines is as good as it is shown on paper. But having said all that, I think the vaccine story is in a lot of ways a success story largely because for the first time in the history of health science, vaccines got produced in such a short time frame. So you have almost changed a 10-year cycle of vaccine production or even longer to so almost a 12-month cycle. So that is unprecedented, and I think all people involved with vaccine production definitely need a pat on their shoulders that they have managed to do something so quickly, which takes a lot of time. And hoping that the vaccine process and the vaccination process gives us the safety and the herd immunity that we desire to get over the pandemic, then it will definitely be one of the success stories. Having said that, one of the questions I would post back is one of the intriguing bits about the COVID vaccine is um, that most vaccine producers have gone with very new and innovative ways of making vaccines, especially the mRNA ones, which is an unprecedented path. So for the first time, we have used methodology to generate a human vaccine, which we haven't used in the past. And I'm a bit surprised with that, largely because a relatively small Indian biotech company has produced a COVID vaccine in a traditional way. And why is that important? That is important perhaps because it is being produced in a traditional way. So within inverted commas, so to say, it's perhaps the safest vaccine because it is not using sort of new technology or new methodology. So one of my surprises is that if a small biotech company from India was able to use a traditional methodology or technique to produce a COVID vaccine, why have the other vaccine manufacturers gone to use a relatively new, relatively uncharted waters with the potential of perhaps less safety or more risk of harm to individuals who receive them. So I think that's a question I'm going to leave out in the open. People who are much better trained and educated in the vaccine field will perhaps be able to answer that. But overall, in a lot of ways, hoping that the vaccines continue to show the efficacy and are safe, it's perhaps one of the few success stories of the pandemic. Also, as part of the vaccine program, we saw reasonably good collaborations of the scientific community between different countries and to some extent between the governments of different countries as well. Uh, and that was perhaps one of the I would say silver linings within the pandemic, that people got together and got the job done, so to say. So I think in a lot of ways it's been a success story of the pandemic.
This is amazing. So I'm intrigued by the traditional and non-traditional ways of producing vaccine. So mRNA seems to be the non-traditional way of producing a vaccine, and a lot of investment has gone into the mRNA vaccine production, and generally mRNA research. This has triggered a whole chain of investments in Silicon Valley and across the globe in the biotechnology market. So traditionally India is focused on traditional medicine. We are traditional in a lot of ways, but for a good reason. I feel there are less side effects because we are focused more on holistic approaches. I think, but yeah. So moving on from that, let's look at the deployment of uh, materials during lockdown, whether it's PPE or masks or generally with the seniors, the food, and most people did not know what a contact tracing application was to start with, especially seniors who needed it the most. So there was a market difference in the approach in the developed and the underdeveloped or the developing countries. So what are your thoughts on that? Like, because you were on the front line, you were wearing the mask, you were examining patients, or you were treating patients. What was it like, that particular phase? What can we learn from that?
Yeah. There's a lot of thanks, Mera. So there's a lot of learning from there. But I think one of the important learnings for healthcare systems is that most healthcare systems understood that their supply chain management wasn't as good as it should have been. So I think it's a big lesson in supply chain management. But I think one of the more important lessons was, if you go back to international and national conventions, if you go back to the literature, the pandemic was predicted. Uh, there are clear instances within the global literature of saying that a pandemic is coming. Uh, and I think one of the main learnings is that different governments all across the world perhaps did not pay as much credence to that, did not pay as much attention as they should have played to pandemic planning. And I'm sure now going forward, pandemic planning will be an important part of most government sort of plans. So I think that that's definitely a learning from the pandemic. I think we didn't take some of this seriously. And if you look um, at how different countries dealt with it, I think the difference largely wasn't necessarily between the sort of industrialized and the less industrialized countries. I think the difference actually was between countries who have managed something similar, be it SARS or MERS before, compared to those who haven't. So I think one of the say, if you look at countries in Southeast Asia which were involved with the SARS and MERS pandemic, they actually managed to deal with this pandemic much better, much quicker, much more efficiently, because it was in their culture, in their ethos to understand infection, to understand contagion, to put on masks, to be vigilant, to show responsibility at a social level. Whereas countries who haven't had that experience did not do that well. The other key factor I feel has been the decisiveness and timeliness of leadership. So if you look at, say, countries like New Zealand, and we can have excuses in saying, oh, this is a very small tiny island, or Singapore is very tiny, or you could say parts of Korea or Taiwan are tiny and that's why they managed it better. Yes, I think numbers do make a difference, but decisiveness of leadership and being very aggressive early on paid dividends for a lot of countries who took it very seriously and went within inverted commas full guns blazing to sort it out, compared to countries who perhaps didn't take it as seriously at the very beginning. So in a lot of ways, for example, in the UK, we were almost doing stuff 12 months late, in terms of the seriousness of the lockdowns, the seriousness of our border controls, the seriousness of our contact tracing, and that sort of stuff. So, and that might be not deliberate, that might be because of capacity or capability issues. But I think previous history of exposure to SARS, MERS, and similar type of epidemics um, helped some countries to manage it better. Decisive leadership in some countries helped those countries to manage it better. And I'm hopeful that for all countries who didn't do that well, it would be an important learning within their social ethos, so that they can manage similar things, similar calamities in a better way going forward.
Okay, awesome. So great. Uh, you know, the size of the country you said is not so relevant here, but have they run the drill or not is probably more relevant. So along those lines, I was wondering, what exactly should a COVID task force look like? Since you work on the systems level, in your particular profession, you have an exposure to the entire healthcare system. What does a task force look like? What is it like when, let's
No,
say, yeah, a pandemic breaks out of some other sort? Then we have very less time to respond. Like, I'm in California here, we have forest fires, we have earthquakes, and there's always someone who's thinking about these things when things are calm and quiet, and everything is hunky-dory, and then they're
sure.
thinking about these things. So what is it like? What is a task force like? What should it be like?
Most countries have some form of disaster management task forces, and some of them are obviously related to pandemics or infection, but some of them are related to other geographical and natural disasters. So most countries, especially in the developed world, have them. I guess it is about how seriously a threat is perceived and how well prepared you are. So I
Mm-hmm.
think most of the countries were not well prepared,
Mm-hmm.
especially in the Western world, perhaps thinking because the last time SARS and MERS happened, it didn't really touch the Western world to that extent. And maybe there was a degree of complacency with regard to this COVID pandemic as well, thinking that it's something out there, it's not going to get to us. And by the time it got to us, it was perhaps a bit too late. And in terms of disaster management and task forces, I think it's a science in itself, and most countries, especially in the Western world, have the technology and the professionals involved to do the job well. I don't think the issue is that. The issue is whether those people within those task forces, within those national committees, are empowered enough to do the job. So it isn't a lack of people not knowing what to do. I think it is about, does it have the national priority and the steam behind it for it to be done effectively, for drills to be happening regularly, for checks to be happening on a regular basis, so that everybody is ready. And one of the important things what I will want to highlight here is one of my big disappointments with some of this have also been a lack of a concerted global strategy regarding this. So every country produced its own strategy. Every country did something different. And while we can say yes, they had to do it based on their needs, it would have been useful, and we could say, oh, maybe WHO did a bit or UN organizations did a bit, but not really enough. This was a global pandemic. This was a ravaging thing affecting most of the world. I would have expected a bit bigger global strategic response within a global framework, that this is what we're going to do, this is how we're going to do it, rather than leaving it to all individual nations to go about their own business their own way. It didn't make sense to me. It would have made much better sense, and we would have contained it much better if there had been a global agreement between countries strategizing that these are the minimum basic things we're going to do as every country in the world or major countries in the world. And then you could have a few additional things that different countries could choose from, whether they wanted to do it or not. There was no global leadership in this domain. Every country was doing what they wanted, what they pleased. And in a lot of ways, that doesn't behove well for us as a global community of humans, because it shows there isn't the degree of collaboration between nations and societies that we need to have to in a way fight a common enemy, whether that enemy is a virus or whether that enemy is an extraterrestrial attack or whatever it might be. uh, the point is, we aren't joined up enough. Human voices aren't joined enough geographically at a country level, or even sort of within different continents of the world. So I think in a way that is disappointing. And maybe you might say I'm too idealistic, that will never happen. possibly so. I am idealistic, uh, but events like these should make us think, how could the global community have come together quicker and generated a framework of practice for all nations to follow as a minimum, and then each nation could do some extra things if they wanted. That would be my thoughts, but I'm open to people who don't buy that opinion, or I'm open to listen to any other different thoughts on the subject.
Yeah, so no, Minesh, I think you're there in the system, you've faced the problem, and you're talking about empowerment. Obviously, it's coming from a place of leadership, so you're not really complaining. You're talking about empowerment here. Can you can you suggest a few ways the leaders in the healthcare and leaders outside who could enable these COVID workflows, they could be empowered? What are a few ways they could be empowered, which you think could be done differently? I know in India right now COVID is at a spike. In US, in California in June we are opening up fully, and vaccines are being deployed for ages below 60 right now. So we have made some progress here, but in India there's another wave. And UK, you'll have to tell me if there's a variant strain which is going around. So what do you mean by empowerment in this situation? We are dealing with three different geographies and leaders of different they need is different here. Every leader has a different task here. So what do you think is the what do you mean by empowerment?
I think one of the important learnings, and I'll perhaps come to that next, Veda, is what are the different levels of learning we can get from COVID. But one of the important learnings within COVID was that people on the front line got on and did the job. A lot of the bureaucracy within healthcare was taken away. And people in the front line were given the freedom, because there was no other choice, to get on and do stuff the way they felt was most appropriate to their circumstances. And what that did was that generated a lot of good work, whether it be within hospitals or whether it be within communities. One of the most important positive, within inverted commas, positive side effects of COVID was the amount of excellent community work that happened within communities, where people went above and beyond the usual to help out for each other's sort of miseries or each other's difficulties. And how did this happen? Because in a lot of systems, there's a lot of management from the ivory towers by remote control. And because of the crisis, that remote control was taken away and people were left to do their bit. People were told to do whatever it takes to look after these patients, obviously within a framework of governance and infection control and stuff like that. But what that did was that empowered the front line to do what was needed. So they were not acting in the system as robots having been programmed to work in a particular way. And as we all know, necessity is the mother of invention. And that necessity, that crisis of COVID generated huge innovation in the healthcare domain, whether it is in terms of digital stuff, whether it is in terms of how you manage patients. So I think that empowerment largely is about people on the shop floor being given their due right of understanding what needs to be done and getting on with it, rather than interfering with their work and considering it to be leadership. Because one of the big problems within leadership is uh, there's a lot of people uh, who feel that policing people is leadership, or who feel I need to tell them what to do. That ain't leadership. Real leadership is about bringing the best out in your people. And how do you bring out the best in your people? A large part of that is through compassion.
Right.
If you are compassionate to yourself and to others, you will bring out the best in people. Um, as healthcare leaders, we need to employ the right people and look after them. If we
Right.
employ the right people and look after them, they will look after the patients. We don't have to through remote control tell them what to do. In fact, if we employ the right people, why should we be telling them what to do? They should
Exactly.
be telling us what to do. So
Exactly.
I think that is quite crucial. And while you were asking about learning, if I may, um, one of the important things from the pandemic is a lot of people have died. A
Hmm.
lot of people have lost their ones, and lost their ones in a very bad way, in the sense that losing anybody is a disaster. But we have lost people who have not been able to be with their loved ones at the time of death. We have lost people who have been on a ventilator for weeks, and people in nursing homes who have died in a bad way. So I think it's not just about loss of life, it's how that came about. And I think we owe it to those people that we learn something from this pandemic. And if I wanted to sort of break that up, I would perhaps say there are things we can learn at individual level, there are things we can learn at societal level, and there are obviously things which we can learn at global level. So from
Right.
my sorry, were you asking a question, whether you
Yes.
want me to go on?
No, 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 no. So Vinesh, I just want to, take a break. Get you on Instagram if you can. We can give one more attempt, because my friends are live, and maybe we can take questions. Do you mind if we join again on Instagram? I'm gonna go live.
Yeah, that's fine. I can, and then I can talk a bit about the individual, society, and global learning. Yeah, that's
Yes.
fine.
Yes.
Take
Sure.
your
Yeah.
time.
So I'm going live now, and I'll send you a request. Right. And I'm going to be adding you. I will invite you. The reason I wanted was, I think I shared the link everywhere except Instagram. We did have some interest from Instagram, so I just want to add you. Okay, looks like there is no echo, or there is.
There is still some echo, but I don't know whether if you can manage it, that's fine. It's okay for me, as long as you people can people are okay with it. I think it's okay on my end. I don't mind. Um, yeah, I think what I would perhaps do is I'll perhaps reframe your question and ask at an individual level, what have we learned from this pandemic? I think that might be a better way to get to the important bits, rather than just saying at an individual level, what should we do in terms of the pandemic. And yeah, sure.
And Minesh is on the front line. He sees patients every day. So let's learn more, Minesh Khashu, about better manage the pandemic as an individual, and then we can move to hospital management. So Minesh, go ahead.
Yeah, I think what I would perhaps think is let's not restrict ourselves only in terms of the pandemic, and I think I would open up the question and ask what at an individual level have we learned from the pandemic, because I think that's perhaps more important rather than just thinking about the pandemic. And I think one of the most important things at an individual level we have learned from the pandemic is that life is very precious. I think we took life for granted. And the number of people that have died in the pandemic have actually shown this current generation, because our generation has not been used to so many people dying, because the generations of the World War One and Two, we didn't get exposed to that amount of fatality and loss of life. So I think what the pandemic has perhaps shown us is how precious life is. So I think the most important lesson is don't take life for granted. Don't take simple pleasures of life for granted. So just going out and having a drink with friends, or just going to the park or having a walk, those were simple pleasures of life which were taken away. And that's the human psychology, is if you take something away, you then realize how important it is. So I think one of the main learnings at individual level is the simple pleasures of life are important. Respect them. You should be grateful every day. Wake up every day in the morning and say how grateful you are. One, you're alive. One, you have a roof over your head, and you might have a job, you have a loving family, or whatever you have. So I think to me that is quite important. At an individual level, the other important thing the pandemic has taught us is what is valuable really to us and what is not. Because if you look at how we have lived the last 18 months, we have realized what were the superfluous things in our lives, what really doesn't matter. So shopping in the mall for 3 hours is not valuable. Yeah. And so I think that's quite important. But the other important thing in terms of the pandemic at individual level is the concept of individual responsibility at a social level. And that has been very well shown in some of the countries that have done well in the pandemic. So places like Singapore, places like Taiwan, places like Korea, places like New Zealand, where people at individual level have shown in responsibility in terms of whether it is face covering, whether it's hand washing, whether it's physical distancing. So I think this concept of social responsibility and being part of a responsible culture is perhaps one of the biggest learning that I would say has come from the pandemic. And then, if I may, if we then look at societal level, what has been the learning at societal level? I think one of the biggest learnings at societal level has been an understanding in society of who the real heroes are. So the real heroes don't live in Hollywood or Bollywood. They the real heroes turned out to be doctors and nurses and cleaners and bin collectors, because we came to understand as a society what are the critical tasks that are required. We didn't talk about a footballer's $1 million fee. We talked about our nurses and doctors and our cleaners. And we talked about the real heroes who got celebrated all across the world. So in that sense, this is a big learning for society. And interestingly, I'm not sure, at least in the UK, the applications for healthcare professionals have gone up 1/3 post COVID, if I can call it post COVID yet. But this year's round of intake for doctors, nurses, and generally people are seeing applications have gone up by 1/3, and I presume it will be in other parts of the world as well. And why is that? That is because the perception at a societal level of who the heroes has changed. The other important thing at societal level is we perhaps understood how artificial our world was. What do I mean by that? Isn't it intriguing that a simple virus that you can kill with soap and water, simple soap and water can kill a virus, but that virus still brought this whole world to a standstill. I think we need to reflect on that. And what were we doing as a society that made it so possible for that to happen? Because uh, on one hand, it is a very fragile virus, but on other hand, it has taught us humans how fragile we are. And finally, at a societal level, we have learned the importance of social interaction, something that we take for granted. Uh, Meeting our loved ones, talking to our loved ones, we have understood how important that is for our sanity, for our well-being. So I think to me, those are big sort of learnings at a societal level. I'll come back to some of the learnings at a global level later. I am just wanting to check whether you had any further queries from your audience or not.
I think people are just listening, so I'll just keep going with my questions. Um, so Minesh, one of the things I wanted to ask you was, what was it like when you were in the hospital? What is your day like in a hospital? During the pandemic, what is it like? How long do you take to mask up? What kind of patients and what are the total do's and don'ts you feel when a patient in the ward? I know you talked about it at humane level, but generally, practically speaking,
Right.
do you see that? Do you see when you see the patient on the bed, you like, I wish they didn't do this, or I wish the doctors had, done something differently. So, hold that thought there. We have some people viewing us for a few minutes now. Please feel free to type in your questions. The audience, we are in conversation with Minesh Khashu from UK. He's a frontline doctor, a very reputed doctor who has expertise on vaccines, treating COVID patients, and he has worked with the healthcare infrastructure. He has good visibility in the UK, US, and Indian market. So if you have any questions about anything related to COVID, you can please type. Minesh, coming back to you again, we were talking about what is your day like in the hospital.
Yeah.
Frontline.
Yeah, thanks, Savannah. So for me, thankfully, maternity and neonates did not get that much affected by COVID. So in that sense, we did not see a lot of COVID patients. So my days in that sense were less. My days in that sense were less complicated than, say, our adult physicians, our intensive care physicians, our anesthetics colleagues, and our respiratory colleagues. I think they have had a horrendous 12-18 months, especially those working in intensive care who were in direct line with some of these very sick patients, some of the patients, many of the patients who didn't make it. I think they have had a huge difficulty for the last 18 months, difficulty at a physical level, difficulty at an emotional level. And I think the after effects of these difficulties are yet sort of not fully understood. And I do feel that unless the healthcare system looks after these colleagues of mine well, we will see significant repercussions of the stress, the anxiety, the trauma. In a lot of ways, this has been very traumatic for my nursing colleagues, for my doctor colleagues, for my physiotherapy and other health professionals, especially those who worked in areas who were very high on COVID numbers. As I said, thankfully, maternity and newborn care was not that badly affected. But I think the implications are huge, and it is important that you raise this question, because one of the learnings for the healthcare system is that how do we now look after these people who have had such significant trauma in the last 18 months, and how do we look after their well-being? How do we listen to them better? How do we organize systems and generate more resilience within healthcare staff? So I think, I think again, we need to bow to these people who have had to put on very difficult PPE for hours and not have a drink, see sort of waves of death and destruction all around them, day and night. So I think there are huge implications for this, and healthcare systems will need to and should focus on the health and well-being, uh, and finding ways of building resilience, finding ways of healing some of this trauma that a lot of healthcare workers and other essential workers have undergone as part of the pandemic.
So Minesh, let me ask you one question. 2020 was like a year of disasters here in California as well. So we had the COVID pandemic first, then we had the forest fires, and then there were earthquake warnings. And what is it that a good system should do in such disaster scenarios? I know there are frontline workers, but do you think as citizens we should go through this curriculum in our school, how to manage a pandemic? And in medical school, everybody specialized in their field. Like you're specialized in neonatology, and somebody else is specialized in cardiology. And the nurses and unfortunately, there are a few people who are on the front line, and they get trained on the job as required. So, what can we do to diffuse this risk and change our education system? Like my daughter goes to school every day. Should she be trained beforehand on all these things? What can we do differently there?
Sure. No, I think that's a useful question. I think all countries should be teaching disaster management. A lot of this is about preparedness. So, so I don't know whether you know. So, for example, in Japan, every school child knows what to do when there's an earthquake, because earthquakes are so common in Japan that it's part of everyday learning and drills for them to know what we need to do in an earthquake. So similarly, I think it is important that in addition to having a national task force on disaster management or sort of pandemic related and otherwise, a lot of preparedness is done at national and global levels. And when we say preparedness, so part of the preparedness would be national task force, supply chain management, having the infrastructure in place, having the governance in place, having the escalation policies in place. But some of the preparedness also is about how do you teach the public some of the things that need to happen when they need to happen. So as I said, going back to a 6-year-old in Japan, she knows what she needs to do if she's in her classroom and an earthquake strikes. So similarly, it should be part of curriculum for all people, to learn some of this stuff, basic hygiene, basic precautions, as part of growing up. These are life skills. They are not necessarily only medical or nursing skills. These are life skills. So the more we teach and train our younger generation to be able to manage this better, the better it will be. So I think it needs preparedness and drills at various levels for people to be able to manage it better. It's simulations, it's drills, and it's education and training.
I think so too, because here in California and I think in India also, people are getting together socially, and when they are together socially, whether it's a social bubble or not, they don't realize how the virus would spread. And there is also this notion about certain people from certain countries that have more immunity because they are raised in a tough environment, and they are not adhering to the practices. So still coming out, or there are multiple strains. In fact, if you look at the research papers, they talk about 7,000 strains of the COVID. So how is this vaccine, going to help? Like we have probably vaccination for one or two strains, but then what about the others? What is the way forward here? How are we better going to prepare for the next?
Yeah, so I think only time will tell how effective our current vaccines are against the emerging strains, and I think it is almost a chicken and mouse game, sort of chicken and egg scenario where the vaccine itself potentially can also at a global level generate more variant and deviant strains. So I think what will need to happen epidemiologically and in forms of vaccine science is we will get better and better. I'm seem to getting a echo now.
Yeah, because I think Instagram we are off now. I'm gonna turn off your. I think you're off Instagram. I'm gonna end it now.
Sure.
So
Okay.
we can just be live here on. We can just be
Okay.
live here on YouTube and Facebook. So yeah, Minesh, you can continue.
Yeah.
There was an.
Sorry. Yeah.
Mm-hmm.
So I think we will have to see. We don't yet have data on some of the vaccines are okay for a couple of the variants, but if more variants get generated, I think what will end up happening is like they, for example, do for the flu vaccine is each year they will modify the flu vaccine based on what are the dominant strains and what are the dominant
Right.
worries. So
Right.
similarly, if COVID becomes what we say endemic rather than pandemic, which means that it is staying or coming regularly in at least particular parts of the world, then they can change or modify the vaccine to suit the most prevalent or most worrying strain. So I think that is that is partly possible as part of vaccine science. But I think for the moment, the more people that get vaccinated, the better chances of us getting herd immunity and breaking the transmission cycle, along with obviously good face covering and regular hand washing and social physical distancing. I think it's important also till we get the scientific evidence that the vaccine in itself is good enough to break the transmission, and once somebody is fully vaccinated they will not pass it on or they will not get the disease. uh, uh, till then I think all the other measures we need to follow strictly. People should not be complacent just that because we have got 2 doses of the vaccine and I am safe myself. We can't risk other people's safety. So 2 doses of the vaccine, after a couple of say weeks of my second dose, I might say, oh, I'm now safe. But I still, for my social responsibility sake, for my community sake, for my near and dear ones sake, I still need to follow the same precautions till the scientific evidence tells us actually, no, we have now enough evidence from the science that you won't be able to pass it on or you won't be able to cause anybody else harm. So I think for now, the best we can do is continue with the three main precautions that we have been talking about the last 18 months. And as and when we are offered the vaccine, take it. And then I guess we will learn a bit more in the coming few months.
Yeah, this is amazing. So this was a pretty insightful session. I think we had some social media glitches. Despite that, some really insightful, enlightening, thoughts came from you. You have the I would say the position of looking at an individual in a hospital, in a healthcare system setup. You gave us amazing insights. So Minesh, any parting thoughts? What is your wish list for us, as we come out of COVID-19 pandemic? What is truly your wish list? What are I know you mentioned a lot of them, but what is your wish
Yeah.
list?
I think for in terms of our wishes, I think one is that we learn at individual and societal level. So if you look at my within inverted commas fake background, one of the wish lists perhaps would be to go on holiday somewhere. we haven't been we haven't been we haven't been out and about, and simple pleasures of life is the fact of going out and having a cup of tea with a friend. We didn't think much of it, but now we feel that is important. But my leaving thoughts would be at a global level, what can and should we learn from the pandemic? And in some ways, I think the pandemic has given us time to think about healing the planet. You will have heard stories that when the initial lockdown happened, suddenly people started seeing more animals and more birds, and
Exactly.
the flora and fauna flourished. So
Yeah.
telling us that if we stopped messing around with nature, there was much better life on Earth. So I think the pandemic, in a lot of ways, to me, is a time to reboot. It's a time to rethink how we want to run this planet, how we want to live on this planet, and how we want to live our lives and interact socially. So I think there's a lot of learning from this, and all I would say is that uh, think at an individual level uh, how precious your life is. Uh, Talk to your near and dear ones, tell them how much you love them. Look at your life and see things that add value, get rid of the things that don't really add value to who you are. And at a societal level, let's do more community based work. Let's understand who our true heroes are. Let's get rid of the artificial type of life that we have created for ourselves, and use this opportunity. Many people have died, many people have suffered in the last 18 months. Let's use this opportunity to reboot the planet, to reboot our lives. It's almost you've been given a chance of a retake.
Right.
Let's do better at this retake. And Thank you, and thank you to all the listeners. I wish you all well.
Thank you so much, Minesh. This was amazing. I'm truly fortunate to have this conversation with you. I remember our last podcast was on healthcare innovation. I do have a lot of follow up questions. I wanted to ask you about a few investment opportunities in the healthcare. What happened there? What kind of startups burgeoned in this, 18 months? But you have a deeper message here. You're talking about authenticity of living, what really matters. So I'll leave it at that. Maybe we can have those questions answered in another conversation. I'm truly fortunate, and thank you so much to be a part of this conversation. And hopefully we can do more webinars together. Thank you so much.
I'm sure, yeah, no, and I think it's an ongoing learning for me as well as for you, and for anybody who's listening in as well.